Hello, good morning. My name is Olufemi Williams. I'm a pharmacist. Today's webinar is something that is very important to me, as way down on my heart that I have to share this. So that is why I'm doing this. I'm recording, so if you are not able to attend this webinar live, there will be a recording. There will be a recording online. So So I think people are calling about this webinar, so let me just respond. The topic is, and I wanted to make it short so that I can finish in about 30 minutes, the plight of the retail chain pharmacist. The agenda is the introduction, the good, the bad, the ugly, the floating pharmacist, practices to be modified or retired, the stark truth, and conclusion. So the introduction, I've been a pharmacist for over 35 years in the US and abroad, and it's been 18 years in the US. The last 6 months, I've worked in a retail chain pharmacy as a floating pharmacist, and I put that in parentheses. So I believe I need to bring some things to the attention of corporate employers and the APHA, that's the American Pharmacists Association, and to offer stern recommendations. So first, let me talk about the good. There was adequate training with a lot of emphasis on exceptional customer service. So that was good. Most of the pharmacy staff at the beginning were courteous and polite when I visited their pharmacies. The staff were allowed to take lunch breaks, and they were not asked to walk through their lunch, so most of them had time to take time off. So that was a good point. The toilets, I believe, were clean, because previous years I used to wonder why there wasn't much attention given to the toilets in pharmacies and stores. But most of the places I went to had clean toilets, which is a big improvement. And many of the pharmacy customers were polite, and they were patient even when they had to wait a while. And of course, when I joined, I was given a very big sign-on bonus. And yes, I have to return it because I did not stay for 2 years. So I definitely have to return that. Now, the bad. There is inadequate staffing in the pharmacy due to companies reducing the staff hours. And it is not that they are not finding people to work. They have well-trained staff, but for some strange reason, they say that they have to cut the hours, sometimes because they feel that store is not making enough money, and so they cut the staff hours. So even though the pharmacist is there throughout, the help, like the technicians or the cashiers, are not given enough hours to work. Then they have unrealistic demands and expectations from the pharmacist and other pharmacy staff. They have various daily tasks that they have to do. And sometimes the staff are more interested in making sure they do the daily tasks than actually doing the real pharmacy work, getting to, helping the customers, doing the we're either putting things back or redoing things. So there's so much to do, and they say you must do everything every day and go and click it off somewhere that you have done it, So there's less time to actually do your job as a pharmacist or pharmacy staff. Then there are continuous phone calls from when you open to when you close. A few stores, when there are fewer phone calls, you find out that the work is moving smoothly. But in many stores, I don't know, the patient must have been told, oh, call. So they keep calling. And then There's some metrics attached to how soon you pick up the phone. So the staff have to pick it up after this and that, So it's so chaotic, and you're wondering, you're supposed to be dealing with people's prescriptions. These are things that they are going to swallow into their bodies. You don't want to make any mistakes. There are all kinds of those are very stressful phone calls, people. And then something I also noticed was there's a lack of understanding of the professional input required when a pharmacist verifies a prescription. What I mean by this is when a customer comes and probably the pharmacist has not verified the prescription, the staff will say, oh, the pharmacist just needs to release it. So in my mind, I'm saying, are we releasing it? Did we hold it? No, we didn't hold it. We are supposed to verify the prescription, make sure everything is well with the prescription. What we do is more than just checking name, date of birth, right drug for right patient. No, we have to also look at a lot of things. There's some things you don't see by just looking at us. But from our experience as pharmacists, from what we know as pharmacists, we can detect if there's something wrong with the prescription. Is this prescription right for this age? Is this prescription, can the person, is this medication right at this time? Is this the right time of the year? There's so many things that go into our minds when we're looking at a prescription. So we should not just tell the pharmacist, oh, release the prescription. We want to tell the patient that the pharmacist has to verify the prescription before he or she lets it, move along. So we're not just releasing the prescription. I just want to see if you can put it in the chat so I know if you can hear me. Somebody said he's here. I just want to put it in the chat and say if you can hear me. If you can't hear me, you can let me know. And so let me just be sure. So the chat is open, just in case you want to. So if you want to put something in the chat, just go to the bottom of your screen and you can say something if you want to chat. There's a thing that looks like text, and then you can say something if you want to say something. So let me continue. So as I said, there's a lack of understanding of the professional input required when a pharmacist verifies a prescription. So please encourage your staff not to just say, oh, the pharmacist needs to let this prescription go. You want to say the pharmacist needs to verify the prescription so that, and pharmacists too, we shouldn't behave as if what we are doing is just, letting it go or allowing the prescription to go. So please let us have this in mind. So that was the bad. Now the ugly. Okay. So let me make this big again. Sorry. So now the ugly part of it. For those who have just joined, I'm sorry, there'll be a recording so you can look at it from the beginning, and also you can download the PowerPoint. But the ugly, so let me just make sure I have everything. Okay, so I hope you can see this screen. So we've done the bad. Pharmacists doubling as cashiers. This is unacceptable. Pharmacists are required to run back and forth to drive through to the pharmacy register. I think this is very unacceptable. There's no other healthcare profession where this is done. You never, even in the smallest of clinics, you will never see a doctor or a nurse or a physician assistant acting as a cashier. Somehow, pharmacists have allowed this. First, we started by just helping, and then before you know it, they made it as if it's our job to also work as cashiers while we are, practicing our pharmacy profession. I think this is unacceptable, and the American Pharmacists Association should call out these employers. APHA, don't just make statements. Call them out. The NABP, Nigerian Association of Boards of Pharmacists, make this, shout it at the rooftop. Pharmacists are not cashiers. Please, please, please. This act should stop. Pharmacists are not cashiers. If you can't afford a cashier, if you cannot afford help for pharmacists throughout the time that they are working there, you have no business opening your pharmacy. So this should be stopped with immediate effect. Pharmacists doubling as cashiers, verifying prescriptions, going to ring patients up, and then even in some cases running to the drive-through. Please let this be stopped. We're going to make sure we shout this out to everybody to hear. And I pray that the American Pharmacists Association will also take this seriously. Another thing I noticed is when I go to a store, it seems as if they have this belief that you should not sit down in a pharmacy. It's like a taboo. When I started working, I saw that the designs of the pharmacy were such that they did not even, it wasn't a comfortable way to sit. So in every store I went to, I took my small foldable stool. And I noticed that people looked at me, strangely. Oh, then you could hear whispers. Are we allowed to sit down? Is it possible? So I was wondering, why do they think we can't sit down? Is there any legal requirement that says the pharmacist cannot sit down? Even the technicians, there's no reason why you cannot sit down. Why should you walk for hours on your feet? So that was something I realized was strange. And reason I even say it's ugly is that you, the pharmacy staff that are suffering, don't even want other people. You don't want them to have a better experience. You want them to join you in the suffering. I'll tell you, I think in the next slide, I'll tell you about an experience I had. But I don't think people should be given the feeling or belief that it is a taboo to sit down in the pharmacy. I go to my mechanics, I go to other places. Even they have, sliding chairs while they are walking. You see them slide under the car. You see them slide around. I still saw a person who walked on my tires sliding around the car with a chair that had wheels, and the chair was brought low. So if other professions are trying to make their work easy, why should pharmacists be trying to make their own work more difficult? I think we are more intelligent than that. So another thing is this continuous phone calls asking for whether we have something which is a class 2 medication. These medications are in the safe. I think the reason why they're in the safe is so that they can be safe from outsiders. So why should we be taking calls with people asking us what is in our safe? Do you have oxycodone this? Do you have amphetamine salt? Do you have this and that? What is the purpose of it being in the safe if we will tell everybody what is in there? First, this is a security hazard. Because if I tell somebody I have something in the safe today, and the pharmacist who is working tomorrow doesn't feel the prescription is good enough to be filled, I've already put that pharmacist in a tight position because I've already told the outsider what I have in my safe. There's a saying that a thief cannot steal what they have not seen. If you've already told people what's in your safe, you're putting the pharmacy staff at risk. Because if they now say they don't want to fill it, the patients will have every right to be screaming and shouting. So please, let us stop this attitude of telling people what we have in our safes. And don't tell them to call to other pharmacies. If something is on back order, let them, try your best. If they are your customer, try your best to get the prescription for them. Don't tell them to be calling around to find out who has it. We are not drug traders. We are pharmacists. It is our responsibility to do our best to get prescriptions, whether they are controlled or not, for our legitimate customers. So don't let us be making our customers call around to find out if there's a controlled prescription in stock. It's not even good for the customers. They are not happy. So please, let us not do that. If you feel a prescription is not good, just say, I do not feel comfortable with this prescription, and I'm not going to fill it. And if everybody says the same thing, nobody's going to, attack you. But if one person is telling a lie and saying, "Oh, we don't have it," and another person is saying, "I have it, and I'm not going. The prescription is not good," you are putting that person's life at risk. Because legally, we are supposed to fill a prescription in good faith. And if you don't feel the prescription is good, then we should not be made liars and say, "Oh, we don't have it," when we know we have it. As pharmacists, we've been honest all our lives. It shouldn't now be because we are working in retail, we become liars all of a sudden. So please, let us make this profession, really professional. Let us stop subjecting our staff to unnecessary ridicule and all this. So that's then. Let me go to the next one, the floating pharmacist. You see, I put the floating in parentheses. Now, that floating pharmacist doesn't float into your store. Some of these pharmacists drive an hour and a half to get to your store. And this time I'm talking to my colleagues, not really to the employers. If you are the regular pharmacist or you are the pharmacy manager, please let your staff know that the floating pharmacist is, helping you. This is the pharmacist who is making sure that your store stays open when you go on vacation or when you need time off. The floating pharmacist is not a burden to you. The floating pharmacist is your help, is the VIP and should be treated as such. Don't treat the floating pharmacist as, "Oh, why do we have this person?" Well, if you don't want a floating pharmacist, then you stay in the store and keep it open. But if a person is assigned to your store to help out, please let them be accorded, the respect and the help that they need. They work in different stores. They don't know the dynamics of your stores. They don't know how you arranged your medications. So don't leave a floating pharmacist and say, "Oh, they should be held to the same demands and expectations as the regular staff." This is something you yourself barely are achieving. So when a floating pharmacist comes to your store, please let your staff and the store staff treat them with respect and appreciation. This is not the time to be saying, "Oh, this person should do this, should do that because I can do it." Well, you can do it. You work in that store all the time. But somebody who comes to your store to help you out shouldn't be now left alone without anybody to help them. That's one. It shouldn't be that I went to a store, and that was what I was going to point. I went to a store after driving an hour and a half to get there just to make sure I opened on time with my stool. And the first thing the store manager did when I got to the pharmacy was to come and meet me and say, "Why do I have a stool? Why there should be a policy that says you can't sit down." I was surprised. I've never heard that in my life. I said, "I'd like to see that policy." Of course, there's no such policy. Because the other stores where I work, there's some stores where everybody has a store, the pharmacist, the tech, and then there's some stores where all of them stand up throughout. So why should you choose to suffer for no reason? So I think some people have this wrong notion that you can't sit down. But even if you can't sit down, as a flute, somebody who came to your store to help out, I don't think that's the way to welcome a person. It's very rude and disrespectful. But I just kept quiet, and unfortunately, it looks like the upper management has not passed this across to the staff to let them know that there's nothing wrong with sitting down if you can. Because even you should take time to sit. You don't stand all throughout your shift. There are some jobs you can do. You can make phone calls sitting down. You can, verify some prescriptions sitting down. You don't have to be walking up and down the whole place. And then when it's time to stand up, you stand up. And then when you feel like sitting down, you sit down. So please stop this behavior saying a pharmacist cannot work without standing up. You can do both. You can stand and sit. It's good for your health. Because then you see the employer sending you flyers about back and foot surgery. Why are you sending me flyers about back and foot surgery when you can make my work place better and more conducive? So that is something that is you should look into. So, and all these demands. I hope I haven't forgotten anything in that area. But please give the pharmacists who come to your store the respect they deserve. Don't treat the pharmacists who have come to help you out as if they are outsiders. If you don't respect the pharmacists, when they come and you talk negatively about them after they've worked in your store, then your staff will not respect them next time they come. So please be respectful to your colleagues and anybody who comes to help you out. These people have made it possible for you to take time off. They've made it possible for you to go on vacation. Please do not be disrespectful to them, either in front of them or behind their back. So, programs and practices that need to be modified or retired. And this is my opinion, because I've watched it even outside of retail. There's this program we have called synchronized prescriptions. And the intentions are good. So this is how it works. You want the people to be able to come, maybe they're on a lot of medications. You want them to come at the same time, maybe every month or the same time every 3 months, so that it will reduce the number of times they come to the pharmacy. So yeah, on paper, it's good. It sounds good. However, there's a problem. You're synchronized, you're imagining it's a perfect world where somebody just takes the same medication, throughout. But it doesn't work that way. Prescriptions are changed. Dosing could be changed. Sometimes the patient, probably went on admission. And when you are synchronizing, you're synchronizing based on the information in your software. But in real life, that might not be the situation. Just about 2 weeks ago, they told the patient, "Oh, we've synchronized all your prescriptions." The lady said, "Yeah, you synchronized it, but on this medication, I still have 40 days left." So synchronizing looks good on paper, but in real life, it's not always perfect, and it can be very confusing to patients. Remember, in most cases, we are doing this for the elderly, and they are the most susceptible to making mistakes. So I don't think we should do this synchronizing of prescriptions. Sometimes you synchronize, and because you have to take out of their refills to synchronize, they end up not having enough for the next fill. And when they wonder, "Why are you giving me only 75 pills? Oh, sorry, we had to take out 15 pills to synchronize you last time." So we've defeated the whole purpose. So please let us rethink this synchronizing of prescriptions. Probably we should work more on delivery so that the patient gets the delivery. If you don't want them to come to the pharmacy, maybe delivery, do find a way of working a better pattern of delivery so that the patient gets their medications delivered rather than just accumulating and confusing the patient. Then the automatic refills too. That is also something I think is not the best. It seems okay, but let's let the patients kind of be involved in their medications. These are things that they're going to be swallowing. Drugs are not food. In the olden days, we used to call them poisons. They are not food. They should be taken correctly. Now, you do automatic refills. When I was doing the medication therapy management with the patients before I worked with this retail pharmacy, I called a particular patient who told me she had a lot of containers of a particular inhaler brand name. I said, why do you have so many? She said, oh, they always do automatic refill for me. I said, well, and then why do you? She said, well, and they call me, so I have to pick it up. I said, no, you don't have to pick it up. Tell them to stop. A lot of these patients think that maybe if they don't pick up these refills, maybe something will be messed up in their insurance or something. So they keep picking up. We understand what we are doing, but the people we are serving might not understand what we are doing. So please, automatic refills might not be the best. Let them have a way like a reminder, automatic reminder, but not actual refills. Because we find out that we spend time filling these prescriptions, getting them ready, and then we have to spend time returning them because you cannot keep them on the shelf for more than probably 10 to 12 days. So please, 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 let us find a way of either modifying or stopping this automatic refills. For companies who have the drive-through, if you cannot have the staff to work your drive-through and your register, please, you have no business opening your pharmacy. The pharmacist must have a staff to help full time throughout the time the pharmacist is there. Do not leave the pharmacist maybe the first hour or the last hour on their own. Pharmacists, we are not cashiers. We are pharmacists. I'm going to repeat this, even if this is going to be the clarion call. Pharmacists are not cashiers. If you cannot afford a cashier throughout the time the pharmacy is open, you have no business opening your pharmacy to the public. So please, 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 this is something we're going to make noise about. So if you try to behave as if you don't know, we are coming after you. So chain pharmacies, don't say because pharmacies cannot open. Many big pharmacies have found a way to frustrate the independent pharmacies in collusion with PBMs and insurance. I'm sorry, but if you were able to, get all the business for yourself, then do it properly. You can't take everybody's business away from them, and then now you say you can't afford to staff. So please do what you can afford. Stop using pharmacists as cashiers. Pharmacists, we didn't go to school to come out and then be juggling cashier work and pharmacy work. So please, and this is a call to the Board of Pharmacy, to the American Pharmacists Association. Immediate effect. Contact all these employers. Say, if you cannot afford a cashier, please do not open a pharmacy. It's simple. And then one more thing that I was thinking should be modified or retired is we have this service where we reach out to prescribers for refills. Let the patients know that this is a free service offered by the pharmacy. It is not a professional requirement. There's no professional requirement that says a pharmacist has to reach out to a patient's provider for refills. It started as a free service. And all of a sudden, it is now, get my prescription from the doctor. And you hear patients screaming, why haven't you gotten my refills? There should be a patient and provider relationship. We were just doing it as an, as a service, as a free service. Please let us not turn it into a requirement. Let the patients know anytime you reach out to their doctors for a refill, make it very clear to them that this is a free service being offered. Please, please, please. And the start truth. So we'll almost round up. And thank you for your patience. Many of your staff, because I worked in about 20 stores in these 6 months, many of your staff have found ways around your demands and they seem to be achieving the metrics on paper. But then they found ways to show that they've done it. That defeats the purpose. You're trying to make them do things that are impossible. So they say, okay, we'll behave as if we've done it, but definitely it doesn't happen. Now, some companies say that, oh, we don't hold our staff to these metrics again. Have you communicated this to the staff? You have penalized them for so many years. So they still have it in their mind that they have to meet these metrics. Have you communicated it to them that, oh, we no longer are going to penalize you. Just do your best. Take care of the customer. But you say it on paper that you no longer penalize them, but they don't know. They are still behaving as if they have to meet those metrics and stats you've given to them. So please, the company needs to reassure this staff that the company, have turned a new leaf, and they are now actually going to be, giving the staff things that are possible to do. But sometimes you see the company says, oh, we don't do this. They take out one task and replace it with the harder task. So I don't know who we are deceiving, but that has been happening. So thanks. In conclusion, I just wanted to point out something. If you've been getting your emails from the American Pharmacists Association, you will notice that the new CEO has sent two important emails recently. One of them was the one where he was telling the frontline pharmacists, trying to encourage them, hold the fort, we are working on it. Okay. And there was another one we got probably about a week ago, which was very disturbing. It says that there's a higher suicide rate amongst pharmacists when compared to the general public. That was strange because I didn't know that, and that is disturbing. Why should there be a higher suicide rate among pharmacists? I thought, this is a wonderful profession that has been good to many of us. Why are people committing suicide? This is of a big concern. I think there should be something to find out why is this happening. I don't know which sector of the pharmacy practice it is happening, whether more in retail or in hospital or in some other part of the profession. But please, I think we should look into it. And the pharmacists and the American Pharmacists Association should stop appealing. We should start demanding better work environments. We've been so good at appealing and working with our employers, trying to be nice. Please, please, please. No other health professionals do that. Let us stop appealing. Let us start demanding better work environments. And as I said before, no employer that cannot afford a full-time cashier has any business opening the pharmacy to the public. This is real. You don't have any business opening your pharmacy to the public if you cannot afford a full-time cashier, meaning a cashier that will work throughout the time, even if you have two cashiers, but if the pharmacy is open, there must be a cashier or a technician acting as a cashier, whatever you have to do. Stop using a pharmacist as a cashier. It should be stopped. I think it should be illegal. So please, 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 this is very, very important. And when I'm saying cashier, it doesn't include calling a cashier from the front to come and help. It doesn't work. It does not work. There has to be a dedicated person who will act as a cashier while the pharmacy is open. Pharmacists should stop being cashiers. Whatever the employer has to do, they have to do. If you cannot afford a cashier, then close that pharmacy. Pharmacists, we should stop being timid and fearful. If we continue like this, we're just going to continue suffering until they degrade our profession. So please, 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 that is what I think. So thank you so much for your time. Thank you for listening. And if you want to ask any questions, the chat is open. You see it at the bottom of your screen. There's something with lines. You can, if you want to say something, you can click on the chat box and say anything, and I'll be able to respond. But if there's nothing, then we'll just close. Now, there'll be a recording. There'll be a recording of this. I try to put it in. I'll download both this webinar and the PowerPoint into my ONET profile. You can find that. I'll put it in a link, so you can download the PowerPoint. That'll be in my ONET profile, Olufemi Williams. So if you go to ONET, you'll find it in Olufemi Williams. So thank you. I don't see any questions or any chats. So thank you, Mr. Kumapai. Thank you very much. And we will post this recording. But in case the recording doesn't show the PowerPoint also, we'll put that in the ONET under Olufemi Williams. This recording will be there. Thank you very much, and God bless.